Good morning, Dr. Yates. It's such a pleasure to have you here today, and I'm really looking forward to gleaning some insights from you about your amazing work. So, thank you for your time.
Well, thanks for the invitation.
Starting with my first question that I know I and everyone will want to know is what got you interested in the first place in studying traumatic brain injury?
Well, I'm trained as a clinical neuropsychologist. So early in my career, I was working at what was then Columbus Children's Hospital in Columbus, Ohio. It's now called Nationwide Children's Hospital. And among my various duties was to work on the inpatient rehabilitation unit, where a lot of the kids who were on the unit had traumatic brain injuries. And I had a wonderful opportunity sort of fall in my lap to get involved in some grant funded research on the outcomes of children with traumatic brain injury. And I was really interested in doing that because of my clinical work. Although there was a growing literature, it was relatively small, and parents had questions for me that I didn't have a good evidence base for. So the opportunity to get involved in research in that area was one I really couldn't turn down,
Mm-hmm.
particularly given the fact that I was trying to help parents and their kids deal with the aftermath of their
Yeah,
injuries.
that makes a lot of sense. At MIST, I know you guys work a lot with stress and the brain. So I'd love to hear from you through your unique perspective. How does stress change the brain and then influence the outcome of a traumatic brain injury? What's the connection there?
Yeah. One of the things that we've increasingly come to realize over the years is that the outcomes of these injuries are heavily influenced by what a child brings to the injury. So it's not just the injury to the brain, but the brain that's injured that makes a
Oh,
big difference. And of course, what shapes a child's brain up until the point they're injured is all their experiences they've had to that point. And so we've increasingly begun to recognize that the experiences kids have prior to their injury play a really big role in determining their outcomes. And one of the things that plays a big role is whether or not they've had to deal with adversity or stress.
mm,
So, for example, we know that kids who have had adverse childhood experiences, something a lot of people are interested in these
yeah.
days, what's sometimes called ACEs, tend to have worse outcomes after having the same sort of brain injury. And that must be at some level because the effects of ACEs on children's brain development is such that it makes them less, in a way, less resilient or more vulnerable to the effect of the brain injury itself. I don't think we fully worked out what's actually happening
Yeah.
to the brain as a consequence of adversity or other childhood experiences that involve stress. But clearly, it's altering something about the brain's ability to deal with this injury.
Isn't that
Uh,
interesting? And just to clarify,
mhm.
when you mean outcome, are you saying that if a kid has had adverse events, a lot of stress, by outcome, does that mean their symptoms are more severe and they don't heal as quickly and bounce back
Yeah,
from a TBI? Or what does outcome mean and how you're
yeah,
investigating that?
exactly. I mean, so we can think about a variety of different outcomes after concussion or brain injury. There's symptoms that children report or their parents report the child is having. There are broader aspects of quality of life. How is somebody doing socially? How
Mm,
do they do emotionally? How do they do in school? How do they do just physically? And we know that a wide range of kind of domains of quality of life as well as symptoms can be affected by brain injury, even in the so-called milder versions like
hmm.
concussion. But there's tremendous heterogeneity. So the same injury can seem to result in a wide range of outcomes, and that's where we've come to recognize that that heterogeneity, that variability in outcome, has a lot to do with what the child brings to the injury in the first place, as well as their environment. So the parents and family
Yeah.
play a huge role in
Wow.
kids. But one of the interesting things that we published that I found really fascinating is we've known for a long time that having negative life events, things that are stressful, hard, difficult, make kids more vulnerable. But typically, we found that positive life events tend to make them a bit more resilient.
Mm,
Well, it turns out when we looked at this in our concussion data, those relationships held for kids with injuries that didn't involve the brain, But
Interesting.
for kids with concussion, it almost looked as if even positive life events happening prior to the injury were in some ways stressful. They actually had the more positive life events they had, the more symptoms they had, in the same way that the more negative life events they had, the more symptoms they had. So for kids that have brain injury, something about having a lot of stuff happening before their injuries, which some of which we would typically regard as stressful, but some we would think was a good thing, turns out to be maybe it wasn't. Maybe it was stressful. And we all know that. We can have very happy events happen, like a wedding or,
That's right.
but
Yeah.
it's still stressful. It's
It's still
hard to deal with.
stressful. I've heard of a term called eustress. So it's still positive, but
Yep.
biologically, absolutely. So it sounds like
Yep.
it's affecting the brain. That's really interesting. What would you say would be a takeaway, or how you feel that your research is making a difference for these kids and their families, or for people tuning into this interview today?
Yeah, well, we've done a lot of different things that I hope will make a difference for folks. I mean, one of which has been to emphasize in clinical guidelines that when people do assessments of kids with concussion, they don't start at the time of the injury. They look back and
Yeah.
look at those risk factors. Did a child have mental health issues? Was there adverse experiences? What other levels of stress was happening? What was happening in the family? Because stress for kids often comes from, say, marital difficulties or financial problems in the family or other things that are causing stress get translated to the kid. So I think one of the ways we made a difference in helping kids with these injuries and their families is saying, look, take a sense what the context was for the child. What did they bring to the injury? Because that helps it perhaps triage kids in terms of who needs more intervention, who might need more assistance. We've also looked at, how do you intervene? And one of the things we're beginning to realize is that we really have to pay attention, for example, to kids' social context.
Yeah.
Loneliness is a big problem after traumatic brain injury, even after concussion.
Yeah.
And if we can, for example, identify the kids who seem particularly socially isolated,
Yeah.
perhaps we intervene there to promote more social interaction, more of a social network
This
for
is so
those.
fascinating. To me, I've had such an aha moment here, like, because I think about TBI as mild, moderate, severe. But what I'm hearing you suggest is maybe it needs to be triaged and looked at differently based on these plethora of risk factors that the kid is coming in with. So maybe
Yeah.
it's not so simple how I've been taught, very
Yeah.
basic.
We're moving away from the mild, moderate, severe because it's
Okay,
a
good.
it's a gross oversimplification.
Yeah,
We're trying to look at it as a continuum
that's
along a
right.
variety of
It should
factors, but
be.
there's a new NIH model for classification of TBI, and one important function that I was part of is called modifiers. All the things outside of the injury that make such a huge difference for
That's right.
recovery, and we're starting to see that really begin to become a part of how do we understand traumatic brain injury, and particularly how do we understand what the outcomes are going to be. The other sad fact is that we're much more effective at intervening at that modifier psychosocial level than we are actually at the medical level. So
Hmm.
almost all clinical trials that have been done with pharmacologic agents have failed with a traumatic brain
Huh.
injury. They just don't seem to be. We've gotten better at keeping people alive. That's
Sure.
great.
But
But
quality.
ultimately, their
Sure.
outcomes don't depend so much on medical care. It really is what do we give them psychosocially with all those
Okay.
modifiers that make such a big difference.
This has been fascinating. Oh,
Yeah,
thank you. Thank you so much for your time and teaching us about this and the
you're
wonderful work
welcome.
you're doing and just for being part of MIST. Thank you so much.
Thanks a lot.